Good afternoon, everyone. The topic of my study is role of citicoline for management of myopic amblyopia patients in a tertiary care hospital in India. I and my co-authors have got no financial interest for this study. Myopia is a very common condition affecting people of all age groups. Nowadays, the increasing trend is seen in people of young and middle age group. Citicoline, that is cytidine 5-diphosphocholine, stimulates dopaminergic system in the brain and retina. Thus, it increases retinal neurotransmitter levels. Chronic citicoline treatment leads to increase in dopamine receptor densities and promotes partial recovery of the dopamine receptor function that normally decreases with aging. Citicoline activates biosynthesis of structural phospholipids in neuronal cell membrane, thus an increased neurotransmitter level and enhanced neuroprotection. It also stimulates glutathione synthesis, facilitates preservation of sphingomyelin, promotes signal transduction in nerve cells of retina, reduces RNFL damage by reducing nitric oxide synthase levels, and attenuates nitric oxide function in the neurons of retina and spinal cord. In this study, we aim to study the effects of oral citicoline as a treatment option in myopic amblyopia by looking at the progression, arrest, or regression of myopia. This observational hospital-based study was performed in a tertiary care center of India between June 2018 to March 2019. Patients of myopic amblyopia of age group of 5 to 30 years were included in the study. All participants provided informed consent before being included in the study. Detailed eye examination, including visual acuity, refraction, dilated fundoscopy, were done. The worst eye of the patient was taken for examination. Inclusion criteria were best corrected visual activity was less than 660 or poor, myopia of more than -6 diopter or more. Media opacity, squint, history of previous ocular surgery, and ocular trauma patients were excluded from my study. The whole study population of 378 patients was randomly divided into two groups. Group A had 203 patients and were given oral citicoline daily for 12 weeks. And Group B had 175 patients and were given placebo daily for 12 weeks. After 12 weeks of citicoline treatment, all patients were called for follow-up after 1 month, 3 months, and 6 months. After the last follow-up of 6 months, visual acuity and refraction was done and was plotted and results were observed. Data was analyzed using SPSS software and differences associated with a chance probability of less than equal to 0.05 was considered statistically significant. Results. This is the data regarding age-wise distribution of patients and effects of citicoline. In this figure, we can see the maximum effect of citicoline was seen in age group of 5 to 10 years, where around 68.42% of my patients showed improvement or arrest of myopia. This is the data regarding sex prevalence of patients and effects of citicoline. In this, Group 1 patients were given citicoline and Group 2 were kept on placebo. In Group 1 patients, we can see that females had a better outcome, visual acuity outcome than males, that was 64%. This is the figure showing the same. This study showed that there is some improvement in visual acuity and refractive status of eyes of patients with citicoline. The improvement was markedly noted in patients of age group of 5 to 15 years, the highest improvement of which was seen in age group of 5 to 10 years. After 15 years of age, refractive status became stable with the use of glasses. Among males and females, females showed comparatively better results in improvement in refractive status and visual acuity with the use of citicoline. Currently, no study is available regarding role of citicoline in progression, arrest, or regression of myopic amblyopia in patients. However, study published by Zhang Fen Mao et al. Showed that intraperitoneal injection of citicoline retarded the myopic shift induced by form deprivation in guinea pigs. Another study published by Prachi Vasant Pawar et al. Showed that improvement in visual acuity with citicoline along with patching was significantly more than that of patching alone. Many studies have shown neuroprotective effects of citicoline in glaucoma, amblyopia, non-arthritic ischemic optic neuropathy, cerebral stroke, dementia, Parkinson's, and many other diseases. Limitations of my study were the sample size was small. Due to high cost of citicoline, the compliance of patients were 80%, and many patients did not turn up for follow-up. We didn't calculate axial length of eyes of the patient prior to and after the treatment. To conclude, citicoline has got some role in improvement of visual acuity and refractive status of eyes of patient of high myopia, resulting in myopic amblyopia till 20 years of age and in females. It may prove to be a promising therapy in retardation of myopia progression and myopic amblyopia in future. Thank you.
So citicoline, it's neurological, neurobiochemical things in various ocular and other diseases
Yes,
are already there in literature. Did you say that there are no other studies?
Yes, sir. I mentioned it.
That in literature, it doesn't show any studies where citicoline is used in
The oral
myopic
citicoline
amblyopia.
has not been used yet. There has been intraperitoneal injection
Well,
given
that's
in.
again
Yes, sir.
that's again animal study.
Yes, I mentioned it that there has
Well,
been no
that's,
study conducted.
no. Did you your search didn't reveal any other studies where citicoline was tried in this?
No,
And I think that somebody should have tried it earlier.
yes, sir.
So, any side effects, citicoline problems in
So
children?
some of my patients turned up with diarrhea and gastric upset, but I could not find any literature that it is a specific side effect occurring due to citicoline only.
So, how will you define the term myopic amblyopia? Your
Sir,
purpose was to evaluate the role of citicoline in management of myopic amblyopia.
Yes,
How will you define the disease?
sir, it is the condition in which it is myopia, which is not corrected by glasses or anything, and when we do fundoscopy, there is no other organic or retinal or any other pathology in the eye.
Patient is myopic, but vision
But
is
still,
poor.
but still, we cannot improve the vision with glasses.
And after giving citicoline, that improved.
Yes, sir.
You are
It
suggesting
has
that.
improved to 1 or 2 vision lines.
Okay, and did you have a control arm?
Yes, sir. I had a control with placebo.
And
I
what
gave-
was the progression rate in that group?
Sir, in placebo, sir, it was mostly the vision was stable. It did not decrease. It did not increase, but it was stable. Like first visit, it was 660. Next visit again, it was 660. It did not decline. It did not increase.
And so what was the dose of citicoline that
So
you
500 milligram OD daily.
used? Your age group was from 5 to 30
Yes,
years.
sir.
And you gave a fixed
Yes,
dose
sir.
to all the age group?
Yes, sir. I gave a fixed dose.
What is the long-term impact of use of citicoline in pediatric age group? Are
Sir-
there any neurological problem that have been described?
No, sir. I couldn't find. In my follow-up period, I didn't find any neurological.
You are affecting the dopaminergic pathway,
Yes,
right?
sir.
So that has long-term neurological implication on pediatric age group.
Yes, sir.
And I think you should go and do a better literature search. There are reports of use of citicoline in amblyopia also.
Yes, sir.
You said there are no report of oral citicoline in amblyopia. No, there are reports.
Yeah. So there is a study of amblyopia, citicoline plus patching in amblyopia and patching alone. So that study showed citicoline along with patching has got better results as compared to patching alone.
Okay, thank you.